Hello. Hi, everybody. We're delighted to welcome you to the third episode of our webinar series, Meeting the Challenge, Evidence-Based Policies to Support Children's Mental Health and Well-Being. Today, we'll be discussing education. So who are we? Change Lab Solutions. Our mission is healthier communities for all through equitable laws and policies. And I just want to share a brief disclaimer and note that the information provided in today's webinar is for informational purposes only and does not constitute legal advice. Change Lab Solutions does not enter into attorney-client relationships. I also want to acknowledge that this training was made possible in part by a cooperative agreement with the CDC, and the views expressed in the training do not represent the official policies of HHS. So an overview of our series, children's mental health is an essential component of their overall health and well-being, affecting how children cope with stress, build relationships, and operate at school and in their broader community. Although mental health and physical health are equally important and deeply interconnected, many families are unable to access timely, effective, and culturally responsive mental health care. Additionally, while rising rates of mental health challenges predate COVID-19, heightened stress, grief, social isolation, and economic insecurity throughout the pandemic have exacerbated these challenges. According to the National Survey of Children's Health from 2016 to 2020, among children from birth to age 17 years, there were significant increases in children's diagnosed anxiety and depression, decreases in physical activity, and decreases in caregiver mental and emotional well-being and coping with parenting demands. However, the good news is that agencies and institutions have many evidence-based policies, options to equitably promote children's mental health, especially for children with disabilities. We are excited to delve deeper into this topic in our webinar series, Meeting the Challenge, Evidence-Based Policies to Support Children's Mental Health and Well-Being, again, supported by the Centers for Disease Control and Prevention. This series brings together researchers, federal partners, national leaders, and Change Lab Solutions staff to discuss policy options that promote children's mental health. This three-part webinar series explores equitable policy options in the following areas. The first one explored income and housing, the second, workforce and healthcare, and today's session is education. Well, my name is Cesar de la Vega. I'm a senior policy analyst with Change Lab Solutions, and I'm serving as the moderator for today's webinar. I'm excited to have with us today Lara Robinson, a behavioral scientist with the CDC's National Center on Birth Defects and Developmental Disabilities. I will hand it to Lara shortly for some welcoming remarks, but before I do that, I'd love to spend just a couple of minutes grounding us in some higher level content to set the table. First, a statement. We believe that education policy is public health policy. Education is a fundamental social determinant of health that functions as a strong predictor of both positive and negative health outcomes at individual and community levels, including disease, disability, mental health, substance abuse, morbidity, and mortality. As I move through the next few slides, I encourage folks to think about some specific examples of education policies that you've worked on or studied that you also consider to be public health policy. On this slide, you'll see a graphic from Virginia Commonwealth University that visually displays the connections between education and health. Education can create opportunities for better health in a myriad of ways, while poor health can put education at risk, which is a reverse causality. The graphic also highlights some conditions throughout people's lives that can affect both education and health. Now, I want us to pause for a moment and reflect on this flip side of things. An unfortunate scenario too often reflected in reality, where what if education policies, rather than creating opportunities for better health, in fact had the opposite effect? What if they put students at risk for poorer health outcomes? What would that mean for the mental health and well-being of our youth? Well, we'll explore some of that today, as well as some ideas for alternative approaches that do in fact support the mental health and well-being and positive development of students. This graphic is a resource from the folks at the Center on the Developing Child at Harvard University. It offers 3 principles to improve outcomes for children and families. So as we explore education policy levers to improve child health, I want us to keep these 3 principles in mind. The first is supporting responsive relationships. The second is reducing sources of stress. And the third is strengthening core life skills. And finally, I want to preface today's conversation by sharing that the education policies lifted up in this session today are not a panacea. Rather, they are one piece of a larger puzzle of policies, programs, and services that can support children's mental health and well-being. And so we want to lift up the importance of things like therapy and other school-based health services that work in tandem with some of the policies that we'll discuss today to support children's mental health and well-being. And with that grounding set, I'd like to now pass it to Lara Robinson for some welcoming remarks. Thanks again for being here with us, Lara. Take it away.
Thank you so much, and welcome again to this webinar. We're so glad you joined us for this important topic. I'm going to talk very briefly this afternoon on educational policy levers to improve child health, school discipline, and children with ADHD or Tourette syndrome. This is my disclaimer slide that states the findings and conclusions are my own and do not necessarily represent the official position of CDC. CDC recognizes the importance of identifying policy levers that support safe, nurturing school environments for all children. We funded Change Lab Solutions to analyze current policies and develop tools to increase the use of evidence to inform decision-making about policies that improve the health of children. As Cesar mentioned, economic stability, housing, and healthcare policies were the focus of other webinars describing our shared work with Change Lab. Specifically, our team works on public health approaches to support the health and well-being of individuals with attention deficit hyperactivity disorder, or ADHD, or Tourette syndrome. In the next few slides, I will give some examples of how our work with Change Lab Solution is related to our populations. Children thrive in an educational environment that values who they are and nurtures their unique strengths and perspectives. Disciplinary practices and school policies shape school climate. Effective discipline creates a safe and predictable environment that supports learning. However, punitive discipline like expulsion or exclusionary practices and imposing negative consequences is less effective and associated with poor school outcomes, especially for students with disabilities. The U.S. Department of Education's Civil Rights Data Collection Survey, CRDC data, report on suspensions and expulsions of children with disabilities. CRDC data indicate that students with disabilities are much more likely to be the subject of exclusionary discipline than students without disabilities. For example, in the 2020-2021 school year, students with disabilities represented 17% of the total K through 12 public school enrollment, but represented 24% of the students who received one or more in-school suspensions, 29% of the students who received one or more out-of-school suspensions, and 21% of students who received expulsions. These data only capture the reported suspensions and expulsions and may even underrepresent the full impact of these off-the-book suspensions, such as requesting early pickup from school, which is not documented officially. CRDC data also indicate the intersectionality of punitive discipline risk. Students who are Black, Indigenous, and people of color with disabilities are disproportionately subject to punitive discipline. Despite overall declines in out-of-school suspension rates among students with disabilities between the 2011-2012 school year and the 2017 and 2018 school year, racial disparities in the administration of school out-of-school suspensions among these populations persisted, and racial disparities in school discipline are present across racial and ethnic groups regardless of disability status. Before I share some more specific data on children with ADHD or Tourette syndrome, I'd like to thank Amanda, Melanie, Alexis, and Becky from Change Lab for their literature review on which this topic and these data on children with disabilities were summarized. Using data from the National Survey of Diagnosis and Treatment of ADHD and Tourette syndrome, which followed up children diagnosed with ADHD from the National Survey of Children's Health, and asked questions about diagnosis, treatment, early concerns, and later impact, CDC colleagues identified that 1 in 20 preschoolers with ADHD experienced expulsion. And this is about 6 times higher than the general population of pre-K expulsion. Those children with ADHD and preschool expulsion more often experienced earlier concerns, diagnosis and medication initiation, severe symptoms, and co-occurring mental, emotional, or behavioral disorders, difficulties with overall school impaired performance, organized activities, and writing. These children may benefit from attending early childhood programs that focus on positive behavior intervention to prevent exclusionary practices and reduce problem behaviors. Youth with chronic tic disorders, such as Tourette syndrome, may also experience higher risks of punitive discipline. Attempts by teachers and other school staff to manage tics may lead to harmful discipline practices, such as suspension and expulsion. Using multiple years of data from the National Survey of Children's Health, children with Tourette were significantly more likely than those without to have a parent contacted about school problems. Traditional discipline may work differently for children with executive functioning challenges like ADHD and Tourette syndrome, and exclusionary approaches can be associated with negative outcomes. However, positive discipline approaches can be effective in the classroom by reducing teacher frustration and increasing success for all children. Positive discipline can improve classroom management and the child's school performance and well-being, along with compliance with federal disability regulations. This is done by understanding the student's skills and needs and using tailored instruction, guidance, redirection, and positive support for meeting behavioral expectations. For example, children with ADHD or Tourette may benefit from rethinking approaches to rewards and consequences. Rewards may need to be more immediate, and consider that the child may be more sensitive to punishment or negative consequences. However, all children can benefit when there are clear directions on behavioral expectations and more positive than negative feedback. So thank you for this opportunity to briefly discuss alternatives to punitive discipline and how positive discipline can be successful for children with ADHD or Tourette syndrome. I will now hand it back over to Caesar and our esteemed panel to discuss some of the policy options and examples of positive approaches to school supports to improve child health and well-being. Thank you.
Thank you, Lara. That was wonderful. I appreciate you teeing that up for us. And I think that sets us up really nicely for our wonderful panel that we have with us today. So I'm going to go ahead and do share bios of the panel before we get into the conversation. So first, I'm excited to welcome Paige Joki. Paige is a staff attorney at Education Law Center, where she represents students, conducts trainings, and advocates to address the individual and systemic educational barriers facing students in Pennsylvania. She is responsible for leading the Education Law Center's Black Girls Education Justice initiatives. Paige joined ELC staff in 2017 as an Independence Foundation Public Interest Law Fellow with a focus on eliminating individual and systemic barriers to quality education for students experiencing homelessness in the Philadelphia region. Paige is a proud inaugural winner of the Temple Law Student Public Interest Network's 2022 Public Interest Impact Award for her impactful legal advocacy. Paige, thank you for being here with us today. Next up, I'd like to introduce Talia Gonzalez. Talia Gonzalez is a professor of law and holds a Harry and Lillian Hastings Research Chair at UC Law San Francisco. Professor Gonzalez is a faculty co-director of the Center for Racial and Economic Justice and writes extensively in the fields of restorative justice, education law, race and the law, critical race theory, health justice and public health, human rights, juvenile justice, and social justice lawyering. She is a nationally recognized scholar whose applied research and collaborative community partnerships aims to disrupt legal, political, social, and economic drivers of racial and gender disparities in public systems. In recognition of her long-term research contributions in the field of restorative justice, Professor Gonzalez is a recipient of the 2022 National Association of Community and Restorative Justice Research Award. She has received grant funding from the Robert Wood Johnson Foundation, Grantmakers for Girls of Color, Annie E. Casey Foundation, and Atlantic Philanthropies for her scholarship and is an expert reviewer for federal agencies, national foundations, and numerous high-impact journals, as well as served as a consultant for the National Institute of Justice. Professor Gonzalez's work has been published or is forthcoming in Boston College Law Review, American Law Review, Wisconsin Law Review, Utah Law Review, the Journal of Criminal Law and Criminology, Fordham Urban Law Journal, Michigan Journal of Gender and Law, NY Review of Law and Social Change, Stanford Law Review Online, UCLA Law Review Discourse, Contemporary Justice Review, and the Journal of Law, Medicine, and Ethics. In addition to leading academic journals, her work appears in the Washington Post, the Atlantic, and the New York Times, and she is cited extensively in the field. She is also the co-author of Girlhood Interrupted, The Erasure of Black Girls' Childhood, the first groundbreaking study of the adultification of Black girls. Talia, thank you so much for being here with us. Next up on our panel, we have Ben Cairns. Ben Cairns has been the Vice President and Campus Dean of the Leadville and Salida campuses since the fall of summer 2021. Prior to that, Ben was the principal of Lake County High School for 5 years. He is a Denver area native with a long career in education, including time teaching in Uganda, developing a restorative justice program for Denver public schools, and opening a public charter high school in Denver. Ben has worked on education policy for the National Conference of State Legislatures, has served on interim legislative committees around school discipline, and presented multiple papers and presentations on the topics of DEI and school safety. Ben has a BA in philosophy from Wheaton College, an MPA from the CU Denver School of Public Affairs, and studied school leadership with principal licensure at the DU Mordridge School of Education. Ben's areas of interest in education have always revolved around students who are not obviously successful in the traditional environment, and he remains passionate at finding ways to help honor those students, their stories, and their pathways into our communities and workforce. Thank you so much, Ben, for being here with us. And finally, our ChangeLab's very own Jessica Breslin. Jessica is a senior attorney here at ChangeLab Solutions, and Jessica works on law and policy related to economic justice, health equity, tobacco, and healthy communities. Jessica comes to ChangeLab Solutions from Bay Area Legal Aid, where she provided civil legal services coordination, advice, and direct representation at the Alameda County Collaborative Court, and built a project that provides special education and SSI advocacy to disabled, delinquency-involved foster youth. Jessica also represented adults with significant mental health impairments on their release from jail in a variety of public benefit matters. Jessica earned her law degree from Georgetown University Law Center and her bachelor's degree in social work and politics from New York University. Jessica, thanks again for being here with us. So with that, I'd like to transition us to the panel, and I will ask the panelists to please turn on their cameras as we shift into our conversation. And to get things started, I'd love to open it up with a broad question to the group. And that question is, why is it important to consider education policies and specifically school discipline policies when we talk about promoting children's mental health in schools? Would anybody like to kick us off with that first question?
I can go through it.
Sure. Thank you, Jessica.
So I think if we're thinking about what Lara just presented and all the disparities in school discipline, and we're thinking about children, they spend so much of their time in school and they can have such a direct impact on their well-being and future outcomes. So it's important that we think about how they're in school and what that looks like and if the environment is supportive.
Exactly. Thank you, Jessica. Did anybody else have an additional thought to add on to that?
Sure.
Caesar,
go ahead, Ben.
Caesar, I think it's always important to acknowledge that educators tend to be good, nice people who want to treat kids well. Mm-hmm. And often the policy context and the institutions have developed in ways that aren't that way. And so I think the policy, I've always thought it's helpful when the policy encourages good behavior amongst educators and really frees them up to do the right thing. And so I think that the policy context is essentially you have hundreds of educators who do wonderful things with kids all the time across the country, but they need that policy context to provide them the support that they need to be able to do the restorative practices and the positive discipline, the things that we know are good for children.
Absolutely. Thank you, Ben. Go ahead, Talia.
I mean, I think it's also important that we don't silo the work, right? It's really, really easy to think about education, law, and policy in one domain, right? Health and mental health, law and policy in another domain, public health in another domain. And when we do that, right, we run the risk of not recognizing that the life course trajectory can be interrupted and disrupted, or can be enhanced based on how a young person is experiencing the world in, right, to Ben's point, right, and to Jessica's point, the duration of time and who they're being exposed to. So if we're thinking about the earlier slides and recognizing that there's not just disparities in the context of school discipline, but that it can be psychologically distressing, right? It's reshaping the way a young person is learning, if they're even able to learn at all. That's not just an education, law, and policy issue. That's also not just a civil rights issue or a disability justice issue. So we are doing ourselves really an extreme disservice when we see them as disparate and unlinked, because they're actually deeply compounding. So, I say this to everyone in the audience. Why is it important? Because every single one of you should see yourself as a health justice advocate and an education justice advocate as much as every other hat you wear, and then bring your expertise and power and privilege to the forefront to advance that work.
Thank you, Talia. Paige, did you want to round us out?
I would love to take us home, and it's so wonderful to be here with everybody. Thank you all for investing your time and sharing your expertise. I'd like to build on a couple of things that Talia just mentioned, that, we know that schools can serve as protective factors, and that includes young people's mental health. And when we exclude children through suspension and expulsion and other informal types of exclusionary discipline that deprive them of their rights and due process, we're sending some really important messages to children and young people that have intergenerational impacts. So we deprive them of their ability to learn. In education, or in Pennsylvania, education is a fundamental right. So we're removing children from a place we've recognized as a fundamental right to them. We are sending the message that they're unwanted and unwelcome in educational environments. And we're depriving them of critical services, including mental health services, which we know, due to anti-Black racism and due to systemic injustice, including because of ableism and differences in socioeconomic privilege, really mental health resources, because we know that our Black and brown young people are more likely to engage mental health supports at school. And so we can't really think about school rules without thinking about the impact on young people's mental health and that of their caregivers and that of those who love and champion them. But so often, as Talia mentioned, those silos are created in false ways that really undermine all of our ability to really ensure we are giving young people every opportunity to thrive, including when they're at school.
Great points. Thank you, Paige. I think you all started to touch on or go deeper into the specific area of school discipline policies, and I think Lara's opening presentation also allows us to maybe skip the last two opening questions and just go straight to the deep dive. So for that, I'd love to kick things off with a question directed to Paige, and that's, how does current school discipline policies and procedures impact students with disabilities such as ADHD and Tourette?
Thank you for this question. And Dana, if you wouldn't mind showing the first couple of slides, and thank you so much for sharing these resources. So I figured it might be nice for us to look at some real world examples of ways that exclusion plays out in our schools. And since Education Law Center is Pennsylvania based, I wanted to share what the law in Pennsylvania is around exclusion. So as folks might know, it is legally required for schools to define and publish behaviors that could lead to exclusion. And in Pennsylvania, we have suspensions and expulsions for out of school discipline. And expulsions can be permanent, and sometimes they are for our young people, which is really a tragedy. And because there are so many different school districts or local education agencies, 779 of them, rules vary wildly. And if you wouldn't mind transitioning us to the next slide, I just wanted to give you some examples of things that can and do today result in suspension and expulsion for young people in Pennsylvania. Things like disrespectful tone and body language, talking back, refusing to cooperate, silently mouthing words, slouching in one's chair, sucking one's teeth, or disruption, which is defined as eating or drinking, standing or running, or being loud. And what you might notice from all of these is it's really subjective. And this is where we see bias play out, both racial bias and ableism and those intersections. And if we're thinking about rules, particularly at those intersections, we can think about racist grooming rules that fuel push out. So rules that ban hairstyles that aren't neat and well groomed are often weaponized against young people who wear protective styles like mine. I'm wearing box braids. Styles that are so-called innovative, distracting, or extravagant, and bans on culturally expressive modes of protecting and maintaining protective styles like combs, headscarves, and bonnets. And so when we think about rules creating climates that are noxious and toxic to young people, when the very rules authorize their exclusion, it is really troubling and problematic, particularly for young people who may have disabilities. If you're looking at the left column here, you can see that a lot of these rules could be weaponized against young people for simply existing, for demonstrating behaviors that are very much age appropriate. And when our first instinct is to punish and exclude, we're really missing the very important opportunity to be giving young people the skills and supports that they need. And really, when you think about disability justice and case law around IDEA and ADA, really, it should come from the fundamental premise and does that all children have the ability to learn. And when we're missing out on creating systems that allow for positive behavior support and skills and positive reinforcement, and our default is punishment, we're missing out on opportunities to keep young people in the classrooms where they deserve to be learning. And we're doing young people fundamental disservices when we're not actually addressing their needs. And I will pause there for now. Thank you so much for the question.
Sure. Thank you for that response, Paige. And I'm always amazed when I look at that list that you shared, some of the things that are on there. It's absurd. You mentioned a really interesting point. You noted, when our first instinct is to punish, we lose out on an opportunity, critical opportunity to actually support children and support their mental health and well-being. So I'm curious, thinking about support and protections for students, what are some current protections and policies that do in fact support students with disabilities in schools?
Well, Dana, if I may, could I show the final two slides? So Education Law Center has a Black Girls Education Justice Initiative, which is our specific work to address anti-Black racism and sexism and its intersections in school. And I wanted to share an example of the ways that push out happens. And I wanted to share Nia's story. And this is based on real examples of a young person who was excluded that was a client of Education Law Center. And her name has been changed for her privacy. So Nia is a 5-year-old Black girl with an IEP, an individualized education program in kindergarten. She has autism, and at age 5, she was very fearful of attending school because her classroom was loud and overstimulating. She was consistently sent home, suspended for crying and for having so-called tantrums, despite a kindergarten through 2nd grade suspension ban that was supposed to protect her in her school. As a result of these rampant exclusions, her mom actually lost her job, and later they lost their housing as a result. And in response to Nia crying and throwing a book on the floor, the school called Crisis, which is a mobile mental health unit, and sought to place Nia on an involuntary psychiatric commitment at age 5 for crying and pushing a book off the table. And when that did not work, they called 911 on Nia after the emergency team refused to 302 Nia, which in Pennsylvania, that's the statute for involuntary psychiatric commitment. And unfortunately, Nia's story is all too common, that young people are placed in the crosshairs of systems like forced psychiatric detention and also intersections with engagement with police, which can be very devastating and last a lifetime. And as was mentioned before, there are also huge and devastating consequences for their caregivers. And so some things that schools can do are they can revise their rules today to eliminate vague and subjective rules that violate children's rights, that sometimes create constitutional concerns, and we know have health harming impacts for young people. So, next slide, please. What can we do about this? I think one really important thing for us to do is honor and champion and be receptive to the expertise of young people who have lived experience in our schools. Education Law Center released this report in 2023 entitled "We Need Supportive Spaces That Celebrate Us. Black Girls Speak Out About Public Schools," which centers the lived experiences of young people who have experienced Black girlhood and attend Pennsylvania public schools in middle and high school. And so there were 8 recommendations that they came up with. Next slide, please. And I'll highlight just a few of them. So from having teachers and mental health counselors that share identities and lived experiences, to having culturally responsive and affirming curriculum, to having fair rules like dress and grooming code that safeguard students' right to expression, including on the basis of their race, their gender, and their religion, and making sure that they're not discriminated against on the basis of their identities or due to their body shape and size, removing police from their schools, and particularly number 5 for today's purposes, ensuring that they have access to culturally affirming and responsive mental health supports from providers that share lived experiences and identities. And I can't tell you enough through my work leading our Black Girls Education Justice Initiative that really implementing policies and procedures that champion young people, that meet their needs and safeguard their rights are really critical interventions to supporting all young people and ensuring that students with disabilities and students of color aren't pushed out of spaces where they deserve to be learning. And I'll pause there. Thank you so much.
Thank you, Paige. That's a fabulous list of recommendations. And I'm curious if any of the other panelists had any ideas to share to build off of that, or if other ideas come to mind in terms of protections and policies that support students with disabilities. Any top of mind thoughts from the panel?
Well, I think what I want to add, and Paige and I collaborate quite often because of the work at the intersection around education, civil rights, and health justice, is that, right now there needs to be a strong attentiveness to the ways in which laws and policies are being changed and passed in states. So while a focus is certainly on how do we think about at the building level and the classroom level, and even at the district level, what existing policies are there that we can amplify, right, that have positive outcomes. Across the country, we're seeing a rise in the use of exclusionary school discipline and the enhancements and broadening of exclusionary school discipline. And so it really creates, I think, some places of needed intervention and urgency to ensure that those proposed laws at the state level, which will direct, right, what can happen, to use Ben's language, right, will actually give significant discretion in the ways we don't want. Right. We'll really create some different opportunities and ways in which teachers can intervene to remove young people from the classroom. So to Paige's point, right, North Carolina, for example, recently added back in dress code violations as a suspendable offense for a minimum of 3 days. And so, what lesson does that teach? Who is that being deployed against? There's a tremendous amount of research, right, that situates in that place. So I think I just want to have us think about both sides of that, because we have such a vibrant and diverse audience here. How you see yourself as a stakeholder in this could be within the context of legislative work to ensure, right, that those really retrenched policies and regressive policies don't move forward to further threaten the mental health and health life course of our young people, as well as really championing at the local level in that school and building and classroom framework what is positive and what's happening.
Thank you, Talia. That's a fantastic point. I think I agree. It's critical to have a lens on both what's happening locally within a school, within a district, but then also be aware of what's happening at the state level, especially if things that are happening at the state level are undercutting efforts at the local level, right? You want to be mindful of both. Do any other panelists have a thought on this before we move on? Okay, so I think with that, I'm actually going to direct the question to you, Talia and Ben, and ask you both, how have the schools and school districts and states that you've partnered with approached positive behavior supports as an alternative to punitive discipline? And what processes were involved in developing those approaches. And Ben, I know, given your job, your like track record and work in the past, I'd love if perhaps you can unpack that for us from maybe a district level perspective. And Talia, would love to hear more about your perspective of this at the state level. So Ben, can we kick it off with you?
Sure. Thank you so much, Cesar. I mean, I think in Denver, which is the story I know the best, Denver and then other small mountain communities in Colorado. In Denver, the story really came from angry and upset parents and students. If you go back into like the early 2000s in Denver, some of the very original restorative justice kind of demands were a direct response to the disproportionality families and students were seeing around school discipline. And that disproportionality is largely affecting students of color, students with disabilities, and some of the issues that Paige and Talia spoke to really well a few minutes ago. And so these parents and students started demanding Denver Public Schools to do something different. And back at that point, I wouldn't say that they had a really clear picture of what that thing was, what that different thing was. A lot of the students and parents were saying, we don't like what's happening. You can't suspend my kid for something that feels really discriminatory to me as a parent. But they didn't necessarily know what it was that they wanted to see happen. And so that's when restorative justice really started to become an option in Denver. And you have other things, PBIS, positive school supports. And I think the menu of options has grown a lot in the last 20 years in terms of what we can do positively with students. There's so many things schools can do to be wonderful and kind and compassionate and supportive to students. But in Denver, really started out with like parents saying, we don't like what's happening. We want something different. And they came across this concept of restorative justice and asked some of us working for the district at that time to figure out what that would look like in a school context. And we know that restorative justice has a long, beautiful history in indigenous cultures around the planet. Every single one of our ancestors at some point sat around a fire and solved problems. But we didn't know how to do that in school, right? Because school had developed into this really punitive, exclusionary type approach. And we actually came to the point, especially in the United States educational system, where we think of exclusion as the only form of school discipline. We actually think that exclusion is synonymous with accountability, right? Even though accountability can be relational. My wife and I go through accountability all the time. When I do dumb things, she holds me accountable. It's loving, it's kind, it's wonderful. And we have in schools come to think of accountability as you need to leave. You need to get out of here, whether that's to the extreme of expulsion or even just leave my classroom, right? Exclusion is the only way we came to think about it. So in Denver, it took us a long time to figure out how do you take this philosophy of restorative justice, which resituates accountability in healing and rebuilding relationships and fixing things and helping support young people on their own journeys and growth and development and mental health. How do you rethink that in a school context? Because schools have become so addicted to just getting rid of children that they perceive as other, bad, whatever word you want to use there. And we know how that plays out, that we had to rethink it. And it really was a lesson in storytelling. And I found that when you started being able to talk to teachers about what do you really want to do here, you invest, 60 hours of your life every week in this place. You don't want to get rid of students. You don't want to push students out, but you have come to think of that as like the only approach. So restorative justice came to be the way in Denver that we initially started trying to tackle some of this work. And so on a very basic level, it just meant replacing exclusionary practices with restorative practices. And every time something would happen in a building, saying, well, we know the exclusionary path. We know how to do that pretty well, actually. American schools are quite good at that. But it's terrible. It's bad for kids. It's bad for young people. It cuts kids off from that thing that's their support factor and mitigates their risk factors. And so we started thinking about how do we just replace those practices and asking a different set of questions when something would go sideways at school. And on one other thing I'll add to this, Cesar, and I could go on this for hours and hours, but I think one other thing I would add that's really important is that with restorative practices, the students are central to the process. They get to tell a story. They get to advocate for themselves. The adults have to also be accountable. I think a lot of what Paige mentioned, like there's no accountability for adults in the school system, right? All the accountability is towards students and their families. And in restorative practices, we're all accountable. We're all in this together trying to create a community, and we all need to be accountable to work together to solve the problem. And the quote unquote guilt that we think of in a traditional punitive system doesn't just sit with the student, it sits with all of us who need to continue to create a better, healthier environment for children. So that's kind of how we got started in Denver. This was a long time ago. You're taking me way back. But that was really the practical implementation of trying to find other ways rather than exclusionary discipline policies to address it when things go sideways. That's not just a student's fault, but it's a collective responsibility to repair a situation.
Thank you, Ben. Go ahead, Talia.
Oh, sorry. I was just going to say, I'm happy to sort of dovetail to your question relative to the state level, and maybe I'll start with restorative justice and then broaden this to think about places where even in the last year we have seen some shining light, right? Some protections relative to exclusionary school discipline more broadly. So the Center on Gender Justice and Opportunity has done both in 2020 and then most recently in this year, a legislative trend analysis of restorative justice legislation. I'm the co-author of that. And we just released that, this year. And so what we've actually seen is an increase in restorative justice laws. So we are now at a higher level than we were before. So there's increased laws, there's more laws. And I think, some updated ways to think about this is in the following. From 2020 to now, we had 9 states that passed 8 new restorative justice laws. And by that, I mean, supports the actual use of restorative practices in schools. And that was really, and that's an improvement. So when we're thinking about, well, what are the things that we can really be promoting as a set of positive interventions, right, to disrupt this exposure to debilitating, psychologically distressing types of practices in schools, right? This presents that framework, at least at the state level, for doing that. So it's no longer than a permissiveness of maybe a district will have the ability to do it, maybe a individual principal, right, who's really strong and has the leadership and capacity and community behind them, but actually puts it in place. One of those laws, for example, actually does have a requirement that it is an alternative to punitive discipline. So we're moving away from a permissive to actually a mandatory way of thinking about that non-responsive, non-punitive, non-segregatory to a set of students' behaviors. Another then actually takes us out of the discipline context, which I think is really important, because when we think across the continuum of the way in which school connectedness and peer connectedness and the scaffolding that young people need, and we all need, right, as human beings, is that it's not just when things go sideways, it's at that early stage. How do we develop those strong relationships and capacities socially, emotionally, and more, so that when things do go sideways, when behavior is in a way that is just disruptive, quote unquote, to a classroom, right? Bracketing that, again, to Paige's point, thinking about deep anti-Black racism and systemic inequality. But when that's occurring, where and how do we have enough relationships built so that the response is not immediately, I want you out, or you're this, or the ways in which, right, that becomes understood. I think what was interesting over these last 3 years is that we saw there is now an integration to cultural competency and trauma-informed framework, so that restorative practices are not a standalone. They need to be infusive of that. And just because it's restorative practice doesn't mean it is anti-racist, doesn't mean that it is culturally competent, culturally affirming, or trauma-informed. So, each of those is really significant. Previously, there had not been good data collection laws, so there still are not enough, but there are 2 new that are actually requiring what is the data collection around it, and then providing resources to have implementation and PD, professional development, for educators and educational stakeholders. Again, thinking much more broadly across that. So, this is a place where we've actually seen really positive inflection points relative to the rise of a legislative and state level schema. In counterpoise, there's actually only been one state, Nevada, who has looked at reducing the use of restorative justice in state legislation, which is surprising given that there's been such an increase in exclusionary school discipline. So when we're thinking about those possibilities in places, I think, the evidence base for restorative justice has built so significantly since the late 1990s, when it was really first being implemented, and even then the 2000s, when Ben and I met each other and started doing this work together to out each other a little bit in age, and what that looked like. So switching to the exclusionary school discipline now more fully, the story is not as good, and I won't go back across a 4-year trajectory, but I want to bring us to a couple highlights. So knowing Paige as well as I do, I will shout out her former state of Idaho, in that In April of last year, HB 281 passed, and it actually limited the use of physical restraint, mechanical restraint, chemical restraint, and seclusion as mechanisms of school discipline. And I point that out because those are things that were all still viable and regularly being used. And so imagine how you, right, being positioned as someone who has care and love for a young person, that a chemical restraint, a physical restraint, or seclusion was being used as a form of school discipline. Sort of put that into the context, and then imagine that impacting their mental health and well-being, especially what we heard at the beginning for Laura. We had states like Alabama and Virginia and Arizona where there were opportunities and introduction of positive laws that would have created greater protections. Unfortunately, none of those passed. The story here in California is obviously a little more vibrant. California is now the first state in the country that has a gradual ban on the use of willful defiance. And so, no longer can willful defiance be a suspendable behavioral offense, right? Again, this importation of this criminal justice and this criminalization of young people into it is why health and a health framework, I think, is really important, right? We need to be talking about discipline exposure from a clinical standpoint, its harms, not how are we protecting ourselves against the disruptive, behavior that young people are engaging in. Illinois was, again, had put into place also things that are really important relative to parents and written notice. Unfortunately, both of those didn't move forward. And even though Florida, and I point this out, has been quite the hotbed for deeply disturbing laws that are restricting and excluding and punishing, there had been a proposal in January of this year that would have prohibited in K-3 suspensions for willful disobedience and open defiance. And so what does that signal? That there are still some possibilities, even in states where there's been a lot more retrenchment around discipline, and Florida has also passed deeply restrictive laws for those possibilities. So I hope that helps, right, to think about how does infrastructure at these different levels, thinking about what Paige just said, what Ben was talking about, also maybe come into play when we know so much that this is still governed within law and policy at state levels, either directively or permissively because there's silence.
Thank you, Talia. That's fascinating. The place where my mind is going now is, I look at our audience. We have almost 300 folks in the room with us today, and I imagine not everybody is a classroom educator. We often have folks from the public health sector joining us. We often have folks from the medical field joining us. So I'd love to talk a little bit about, you mentioned infrastructure. And when I think infrastructure, one of the things I think about is partnerships. Who are the folks involved? How are folks plugging into this work? Who are the allies in this space? And I would love to hear from you all. Maybe we can start with Ben and Talia again. Were there specific partnerships that were developed to implement some of these policies that you all touched on, especially if there were any partners from non-traditional places, right? So folks like county health workers or pediatricians or social workers. There's so many folks whose work is impacted by these policies in different ways. So I'd love to hear how different sectors and partners have plugged into this work.
I mean, Cesar, I think for the Denver story, in terms of like those non-traditional partners, they really emerged quickly. Padres y Jóvenes Unidos was initially a Latino-based parent and student organization that was absolutely instrumental in moving this work forward, not just in Denver, but in all of Colorado. All of our mountain communities and all of our rural communities outside of the Denver metro area have some kind of, restorative approach and are thinking about these things because the work of this group of parents and students called Padres y Jóvenes Unidos, they've changed their name and is now called Movimiento Poder. So movement of power, if you want to translate it like that. And their website's available. And some of the folks working there worked on this as students and are now, working in legislation and in policy now a long time later. Initially in Denver, the Denver Classroom Teachers Association was actually quite opposed to restorative practices and restorative approaches. The way it was framed initially was that it was going to take power away from teachers, and teachers weren't going to be able to have the authority over their classrooms they felt like they needed. That has completely shifted. And the DCPA has become one of the biggest advocates and supporters of restorative practices in Denver, and has actually put out studies and has become one of the principal champions of this work. And that was a wonderful shift to see the Teachers Association in Denver kind of change their thinking around what these practices might mean, and coming to realize that, treating a student restoratively, engaging in their mental health, being culturally responsive doesn't actually erode the power of a teacher, but actually creates a relationship between the student and the teacher that makes the whole environment so much better for everyone. So that was a massive shift that we saw in Denver. Denver also used to have a juvenile youth court that was it was an attempt to be diversion and sort of separate. And the judges in that court were actually very supportive of what we were trying to do back at that time, as were a lot of the folks working in probation and pre-adjudication, things like that, people who were actually working in the system, who were seeing how dysfunctional the system was. And often it was people working in the system who were seeing these referrals to law enforcement. They're like, this is insane. Why are we getting referral to law enforcement for clearly age-appropriate juvenile and adolescent behaviors? I'll tell you why we're getting them. We're getting because they're students of color. And we don't know how to, our teachers weren't equipped to handle and work with students who maybe present differently. And so, like Paige really eloquently pointed out, things like defiance, right, were used all the time in Denver. And even in Colorado at one point, that was an expellable. You could be on a mutually disruptive contract for just being overall defiant over time. And that's no longer allowed in Denver public schools. And that's because of the great work of a lot of people. And I would say on the law enforcement and juvenile justice side, people saying, this is crazy. Why are we getting these referrals? These are not criminal behaviors. Now, there's a whole lot to unpack there that I'm not going to go into today, but at least at the beginning, in terms of like non-traditional people who are advocating for these changes, it was student and parent organizations. It was the Denver Classroom Teachers Association eventually, once they kind of understood what it was about. And then it really was people within all the different systems in the Front Range of Colorado saying, this is not appropriate. These are appropriate adolescent behaviors that we need to work with students on. These are not, behaviors that need to be referrals to law enforcement and need to be subject to school discipline and exclusion. So those are some of the non-traditional folks, say they're early on. I would say one other piece that's really important in kind of the school discipline reform effort that we've seen in the country the last 25 years is that you have to eventually engage people in the school system as well. Across the country, there are lots and lots of programs that are quote unquote restorative in nature, but they'll often include an outside organization, an outside nonprofit. Our Joey in Oakland's a great example, and these organizations are fantastic. They do great work. The challenge is if it's not embedded in the actual school system. If you don't have folks who are currently day in, day out working in the school system engaged in these practices, and you're quote unquote offloading it to an outside entity, then it doesn't necessarily work as well as it could. And you're not seeing the school system itself fully buy in to being restorative. I've seen school districts across Colorado unload the restorative practice to an outside entity, and the level of investment from the school system is just not there. And schools are good at complaining about money and financing, and they should, because it's appalling in our country. Colorado, where I live, 47th in school funding. Yes, we don't have any money. However, every school district in the country, every school pays someone to deal with students when things go awry. They can do that restoratively, or they can do that punitively. And so sometimes when school systems, and I'm sure people in this call are going to say, but Ben, we don't have the money for this. We can't do it. You absolutely can. Every single person can change their mindset and choose to interact with kids differently. And sometimes we sort of use that we don't have funding as an excuse to not be restorative with children. More funding would be nice, but it is not a reason not to be restorative.
Thank you, Ben. Talia, do you mind if I direct a specific aspect of this question to you?
Sure.
Yeah. I know a lot of your research has directly involved students, and I'd love to hear like a little bit more from your perspective about how students are being centered in the development and implementation of these policies, this work, and sort of what works well, what doesn't work well when students are really being centered in the work.
Sure. So I'll bucket that into, and I know we're running short on time, into sort of two different places. One, on the research side, participatory action research, or YPAR, youth participatory action research, has become essential, right? And that's exactly what Paige described. They are the experts. They have the expertise. They know what is happening in a classroom, in a building, on the street, any of the places, right, in which their life is intersecting with system actors, and can then offer a set of wisdom and advice and practices and policies if we actually listen, right? And so as a field, right, multiple fields, whether we're talking clinically in terms of the health fields, or we're talking in law, or in social sciences, YPAR has become, right, a mechanism and an actual framework to thinking about from the inception of the idea to the execution of the research plan, and then all of the components of it. That's also true in the development of policy and practice. And that was certainly the case here in California. So when we think about the willful defiance ban in particular, and the work that it took and was generative, this was not the first legislative cycle this was introduced. This was introduced over multiple legislative cycles. Young people were at the forefront of what the context of that work meant, from a whole host of youth-led or either youth-led organizations or organizations that recognized the power and wisdom of youth and then supported them in that work. And they served in providing testimony, right? They were there in developing the toolkits and the resources. So from soup to nuts. I will say, in conjunction with that, to I think part of what your earlier question asked of those non-traditional, quote, players in education, law, and policy, is that county mental health offices and departments started to see school discipline and that exposure as part of what they needed to think about in mitigating exposure and that risk. And so those also across the state and up and down the coast and inland became strong players in thinking about that legislation in particular. So I really do urge us to think about the ways in which young people should be centered in the context of this work. And I don't mean that in the 3 young people sat on a panel and everyone oohed and awed because there were young people that sat on a panel, because I have seen that happen way too many times, but that they're part of the deliberative process for the work in which you're doing. And that's okay if it goes a little bit slower, right? Or because it goes faster sometimes. But I want to be real clear when I'm talking about participatory work, it's not that. But this point about adolescent development, sort of built into all of those components. And so having your health departments, both at the county level, at the state level, as active stakeholders and collaborators, having your legislative committees that actually focus on health and mental health. I know that Alexis Eto, who is at Change Lab Solutions, and I have provided testimony in different states on this matter in particular. But also really thinking about this exposure as adversity. So that's where the work that I do now is actually deeply centered, is understanding exclusionary school discipline and segregation as an adverse childhood experience. And I work with 2 pediatricians, a psychologist, and a district here in California. That I can't provide the details about very specifically, and Paige as well. We are advancing that framework, and we are doing that work now, and have a series actually of convenings around it to develop what that will look like, because that will shift. Because if exclusionary school is understood as an adverse childhood experience, our response now is about mitigation of that exposure, not about, well, can we now stop it at the back end? So we will have to be proactive instead of reactive.
That's exciting. Thank you, Talia, for that response and for giving us a little preview about the work underway. I can't wait to see and hear more about that. I know we are approaching time. I do want to name for folks who are asking questions in the chat about resources. We do have many resources in this slide deck. One that I will point folks towards is a new resource that's been developed by Change Lab Solutions on developing positive disciplinary strategies to support children with ADHD and Tourette syndrome. Beyond that, we also have additional resources that from Change Lab Solutions, we have some additional resources that Paige was willing to share from her organization. We have some additional resources from the CDC as well. So as you scroll through the slide deck, just know that we have plenty of resources coming your way. In our last minute together as a panel, I'd love to have a closeout question, sort of a high level, quick response. There was a lot of rich content shared today. If you're somebody who's hearing this and is excited to take action, what is a great first step? What's a good starting point for somebody to become more involved in supporting school discipline policies that improve educational opportunities and support children's mental health and well-being. And I'll open that up to the whole group. And you could speak to it from a very specific perspective or a general perspective. Would love to hear your thoughts on that as we close.
You work in a school, simply ask your folks there to examine all of their policies and all their practices, look for any kind of disproportionality in your data, and then know if you have disproportionality in your data, you have a problem and you have a systemic bit of racism in your system and you need to address it. And restorative practices are one small step towards potentially addressing it, along with all the other smart things everyone else has said on the call. It's very doable. We've all participated in restorative justice in our lives. We can all do it. There's no reason to be scared of it and not try.
Thank you, Ben. Others with a closing thought on this? Good first step, way to take action.
I think it's just knowing where you have the privilege and power to activate different levers for change, right? We all don't have to do the same thing, though I would love to be obsolete. So make me obsolete and do all this work. But to that extent, like that's what I would really challenge people to look at the portfolio you carry, the work that you do, and see at what place and space you can be engaged and how you could do that collectively.
Thank you, Talia. I know discretion is a topic that often comes up, right? And the ability to make a call on whether to, get folks involved or not, right? There's so many ways that folks do have power within their positions to make the right judgment call. Paige or Jessica, do you have a final thought on this as we close out?
I do. We can't and shouldn't accept exclusionary school discipline as a response to student behavior. And if you happen to work for a school, ban it today. There is no legal prohibition against choosing to do things that are better for young people, including restorative justice interventions. And so be a leader and join us. If you want more information, there's room for all of us to move this forward.
Thank you so much, Paige. Jessica, do you have a thought or?
I think I just want to echo what everybody else has said. They all make really great points. And also I really appreciated Ben's points about the data. And I think taking a look at it so you understand where the problems are is a really important first step.
Absolutely. Absolutely. Well, with that, I want to take a moment to thank our panelists so much for joining us today and sharing your wonderful insights and experiences. Jessica, Paige, Talia, Ben, thank you so much for your comments, your thoughts, your resources. And Lara, thank you so much again for setting the table for us. And I just want to thank everybody who made it out today. Again, this is the third episode of our webinar series, Meeting the Challenge, Evidence-Based Policies to Support Children's Mental Health and Well-Being. And I was really excited to do a deep dive on education with you all today. So with that, I will close this out and wish everybody a wonderful afternoon. Take care, everybody.